majority of spinal injuries occur as a result of accidents. So the most common cause is probably road traffic accidents. They might be from horse riding accidents, diving accidents, things like that. But there are a minority of such injuries that occur through poor medical treatment. That may occur when there's a failure to treat an urgent condition, a condition that requires urgent treatment, such as a spinal abscess or cauda equina syndrome, and the failure to provide urgent medical treatment in that situation can result in paralysis or a really disastrous outcome. Secondly, in terms of medical cases, there might be a failure to treat a less urgent condition such as a prolapsed disc over a period of time, and the failure to do so may lead to a much worse outcome for the patient than would have been the case had the treatment been given in the appropriate time frame. Thirdly, spinal surgery itself can go wrong. So when somebody goes in for an operation to treat a spinal condition, something can go wrong, and that can be a disastrous outcome if, for example, there is damage to the nerve roots or the spinal cord. And then there are claims that are crossover claims between personal injury and medical negligence, where someone has an accident and then the treatment to put right their spinal injury from that accident is carried out poorly, and sometimes in those situations it may be necessary for somebody to sue not only the person who caused the accident but the person who treated them medically afterwards. I deal with a wide range of spinal injury claims, but the ones that I've dealt with most commonly involve spinal abscesses and cauda equina syndrome. In cases of spinal abscess, typically what happens is somebody will present to a doctor with a temperature and tenderness and pain in their spine. It's a medical emergency and it needs to be recognised as such. What needs to happen is that person needs urgent admission to hospital, and they need essentially to be treated with antibiotics intravenously, and very probably they need to have surgery. Usually the abscess needs to be drained, and the spinal cord needs to be decompressed because the abscess may have been compressing the spinal cord. If these cases are not treated as medical emergencies, then it's possible that the outcome will be paralysis for the patient. So it's very, very important that things are dealt with in a very tight timescale. I've dealt with a number of these cases, and in these cases, usually the medical experts that I instruct will be critical of the doctors for failing to recognise the emergency and failing to act swiftly enough in order to decompress the spine and drain the abscess. The other common type of claim that I have dealt with is a cauda equina claim, and this basically involves damage to the nerves at the base of the spine. Typically, the outcome can be very poor for patients who may be left with double incontinence and loss of sexual function. So it is a very serious condition. It usually presents with an inability to pass urine, with pain, weakness, and a loss of sensation in the saddle area. Unfortunately, the symptoms are not as well known to GPs and those in primary care as they should be. Sometimes the diagnosis does get missed, and again, this is a real medical emergency, and unless somebody is referred to hospital very quickly, the outcome can be very bad. So these cases, as you can see, are very, very serious, but they're cases in which I have significant experience. All spinal injury claims are complex, both legally and medically, and they're difficult claims to run. In addition, it's likely that you will have suffered very significant injuries if you've had a spinal injury, and those injuries can be life-changing. You really need to have a specialist in clinical negligence and someone who is accredited as a specialist. For example, AVMA, who are a charity in the medical negligence field, give accreditation to lawyers, as do the Law Society and the Association of Personal Injury Lawyers. At Withy King we're accredited by all of those organisations. In addition, you should look for somebody who's actually experienced in running spinal injury claims and has run several of those claims previously. Again, at Withy King I have that experience, and others of my colleagues have significant experience in running these types of cases. We are very happy to travel to your home to see you. We appreciate it may not be possible for you to come in to our offices. But above all, we're committed to getting the best possible outcome that we can for our clients.